Ugonjwa wa pumu au asthma ni ugonjwa ambao huathiri sehemu ya kupitisha hewa kwenda kwenye mapafu ya binadamu. Sehemu hizo hupunguka na kuvimba na kutoa kamasi ya ziada ambayo husababisha hali ngumu ya kupumua, kikohozi na kupumua kwa pumzi.
Asthma is a respiratory condition marked by spasms of the airway, which basically makes it breathing difficult, causes difficulty in breathing. So it's basically narrowing of the airway, putting one to have difficulty in breathing.
Dalili za ugonjwa wa pumu ni pamoja na kukosa kupumua vizuri, uzito kwenye kifua au uchungu, kutoa sauti mtu anapopumua. Hivyo, ni vizuri kumwona daktari endapo utaona dalili hizo na kuanza matibabu mapema, kwani huchangia hali tata.
The most common signs and symptoms of asthma are: 1 is difficulty in breathing, 2 is wheezing when breathing, 3 is chest congestion. Sometimes people experience chest pain and coughing. Those are among the most commonest. But those signs just suggest, they're not very specific to asthma. They just suggest that one could be having asthma. We have diagnostic tests which confirm that one has asthma, and these are only 2. One is called FeNO test. Okay, FeNO test checks the amount of nitric oxide in your breath and gives the clinician or the doctor a hint that or an idea that this patient could be exhibiting could be emitting more of nitrogen oxide, which basically indicates that your lungs your airways are inflamed and they're emitting that component. The other one is spirometry. And spirometry is it's basically a lung function test. It checks the amount of air getting inside and out of your lungs during breathing. Okay, we are now combining that with the clinical symptomatology. One comes up with a diagnosis of asthma.
Baadhi yanayochangia kuathiri mtu aliye na ugonjwa huu ni kama vile mzio wa kuvutia hewa, kama vile chavua, kombamwiko na vumbi, maradhi yanayohusiana na upumuaji kama vile mafua, hewa baridi, manyoya ya wanyama wa ndani kama vile paka na mbwa.
Asthma is caused purely by exposure to triggers. It's the triggers of asthma, the allergens like pollen, like dust mite, like cockroaches, dantals, and many others. So
inashauriwa mwathiriwa kutumia kifaa cha kutoa pumzi, yaani inhaler. Lakini je, endapo utakuwa karibu na mtu ambaye amezidiwa na maradhi hayo, daktari anaelezea ni sharti
in case they have an attack called asthma attack or asthma exacerbation, they use the prescribed drugs. In an event that they do not have the inhalants or the prescribed drugs, we advocate for them to just be calm, sit up, take a sip of warm water, then just try and breathe shallowly, more frequently. So that basically permits a substantial amount of air to get into their lungs, and for them to, of course, now reorganize. Are they reorganized for their transfer to a facility where they can get help?
Na japokuwa ni maradhi ambayo hayana tiba, madaktari wanashauri ni sharti mwathiriwa aepuke vitu vinavyochangia makali ya maradhi hayo na kutumia dawa ipasayo.
Asthma is a dangerous disease, and asthma kills if not well treated. The reason behind this is because asthma causes airway narrowing. And when the airway is narrowing and you're not given drug to reverse that narrowing, the narrowing continues. If the narrowing continues, it means one does not get adequate amount of oxygen in their blood. So they get hypoxic, or the amount of oxygen in their blood goes extremely low. That puts them at a very high risk of getting hypoxic death. Okay, hypoxic death, I mean death as a result of low oxygen level. Okay, asthma, if it's untreated, still damages lungs. Okay, so lung damage has so many other long-term complications. So asthma is very important to be seen early enough and get treated.
Ni takriban watu milioni 4 humu nchini wakisemekana kuathirika na ugonjwa huo. Joy Nzula, Undugu TV.